Good day. This is Erin with the Mastectomy Guide, and I am here to help you become the go-to therapist in your area so we can get trained therapists who can do breast and chest care all over North America and beyond.
Mm.
And today I have Kirsten with me, who is a graduate of our programs. She helps me in the programs as well, facilitating workshops, and she has been making some wonderful changes to her massage therapy practice. And it's really good to hear people's story about, opening up to the breast and chest population and the differences that it makes. So, Kirsten, let's start with what was your big why for getting into this line of work?
Mhm.
We're a general massage therapist, had a general
Yep,
practice, and you've
yep,
got your clinic in Cumberland, which we'd love to
that's
hear
right.
about.
Mhm.
But you went through some changes and some
Yeah,
changes in your life, and it
yep,
opened this up. So we'd love to hear how that went for you.
for sure. I think with like women's health has always been a part of my practice, and a lot of my practice right after massage school was focused on prenatal, postnatal. I'd had kids myself, and so I kind of had that understanding. And I was about, let's see, like I graduated in 2008. And so around 2021, we had just made it through the pandemic and it was feeling kind of intense. And I was like, oh, it'd be nice to like add more to the women's health. And then you were going through your own journey and I happened to see it. Like you just put out sort of a nice offer. You were like, hey, I'm on the BCRMT page. Would anybody be interested in learning this? And I think you got flooded with like a lot of response.
I
And
did.
so I was one of them, and you had offered to do a course in Victoria. So that's only 3 hours south. So I was like, yeah, that's perfect. I will go down. And yeah, it was incredible. I can't remember the venue that it was at, but it I sat with one of my teachers from massage school, which was really, really neat. And we both had similar conversations just about where we were at with our practice and how we'd been doing it for some time. And we were looking for something that felt more heartfelt, but also easier on our bodies and
Mm.
aligned with sort of the direction that we wanted to go in our practice. So that was just a weekend course, and that was your, I don't even know if you called it foundations or what you called it, but I was there. And then I came back, and immediately people started talking about that I'd done that course. And I actually had a lot of people come to me that had had breast augmentation, which I didn't necessarily anticipate, but that was who the clients were that were coming in. And so I could tell already just by that brief one weekend course that I was like, oh, this is being talked about and this is needed. And there's no one else in the community offering this at this time. Um, so yeah, that was the very first one, and there was lots of inspiration in that. And then a couple months later, I got in a rough car accident, and I was injured more than I realized, and I had to take 2 years off work, and I had a wrist injury, and that injury was like, uh-oh, can I be a massage therapist? Can I go back to work? And then it popped back into my head that I'd taken that course with you. And meanwhile, you were developing, offering more courses, and just at the time where I was like, I wonder if I could do that work, you offered the 7 day intensive in Cloverdale. And it was one of those things where you're like, will that work? And it just all aligned. And so there I was doing that, which I was really grateful for because I actually appreciated, and you were still sort of exploring how to teach and the layout. And so we did the 7 day intensive, which I thought was wise in the sense that had the 2 days and then a day off and then 2 days. And it made this really beautiful collective group. And the more that I got into your courses, the more balls kept turning and being like, wait, this is bigger than like, I don't know. It's like I was thinking about it this morning. Like this is kind of beyond just massage therapy. And I think as massage therapists, we often feel like we're put in a corner. And this way that you're teaching is so collaborative with the entire healthcare system that it's gives the confidence to sort of weave yourself in with other health professionals and look at it in a very different way than
Mm,
just being like, I'm only here for you when you're on the table. And
love it.
so lots of inspiration came from that. And then you presented also the idea, because you're an idea maker, that you were going to do the academy. And then I was like, okay, this is just keeps going. This woman is incredible. She won't stop. So I was like, yeah, I'm in. Like I was with you the whole time. So I was like, let's just keep going and see what happens from there. And I think what you've built is really cool because it's created a community amongst the people that are in the academy with you. But it's also, like I said, it's creating this community and it's sort of a ripple effect that's happening. And so people are reaching out to us, whether they're clients that are looking for breast cancer or other health professionals or other massage therapists, where they're like, I see something different that's happening in your practice and I'm curious about it. So
Mm,
now fast forward, here we are. And I've been lucky enough that another massage therapist in my clinic in Cumberland has also taken the program, Jen. And so both of us have really been able to work together on how to promote, get ourselves out in the community. We had set up a booth at the Pride Parade last summer. We're in contact with Foundry. We sent out all our surgeon letters, which you recommend within the academy. We had a surgeon reach out to us and come to our clinic to meet with us.
mm,
And then what just happened just 2 days ago is one of the physios in town who has been on a similar journey with me where she's done like post-cesarean and then she's doing more work with breast cancer patients and lymphedema. And she did her training actually in 96. So she's been in it for a long time. And so we had a collaborative meeting together and she's meeting regularly with the surgeon and we're all witnessing that gap. So we're like, how can we form a team that we all work together so that we're getting this information to the clients in an effective way? And that has never happened to me in my massage therapy career ever. And
so
so,
cool.
yeah, I think, and that is just so cool because it's like I said, like I think massage therapists often we can feel like devalued or there's you might get into that old school doctor mentality where they don't believe in it or whatever. And yet the opposite is happening right now. And there's this need with those two women who work in this field to be like, we will work best if we all work together. And so they're looking into grants to make printable material that so it can all go to like the clients right away. We're looking at talking to other surgeons so we can get that conversation going with the other folks, with the other surgeons who maybe don't understand what we're offering and looking at sort of how and when we can refer to each other. Pretty
Mm,
cool.
so cool. Oh my
Yeah,
gosh, I love it. That is so
yeah,
exciting. What
yeah,
like amazing changes that you've been through from
yeah,
when you started and you were just kind of
yeah,
like, what's going on here?
yeah,
There's
that's right.
interesting. Yeah.
That's right.
And then your challenging car accident
Yeah,
and rehab where you were
yeah,
really, questioning, am I going to be able
yeah.
to do this? How can I still be of service?
Hmm.
Finding out, oh, this is possible. This
Yeah,
is actually possible. And now growing and making these beautiful connections in your community. I
that's
mean,
right.
it's so next level. It's just that's so exciting. And to be able to collaborate with the surgeons and the
Yeah,
surgeons understanding like there's something
yeah,
valuable here and it's going
that's
to be
right.
a benefit to our patients if we can work together.
Hmm.
The ideal. So you're an example of that, which I love.
Yeah, it's pretty cool. And I think the thing is too that like is kind of neat is like I graduated in 2008. So and Jen also we're both quite experienced RMTs. And so we also have to like our bodies are changing too, right? So we're having to make that shift onto like what does it look like in the next 10 years for us working? And even with talking with the physio too, she's found the work so much easier on her body as well. So it's really like that nice transition. If like, as for myself as an experienced RMT, there's some things that I'm going to have to start shifting within how I'm scheduling. Because if I treat other people, that part has been very busy. So I'm having to look at being like, okay, what is it going to look like? And when are my times going to be? And how can I shift into this being a part of the practice? And there's cool things you can do with that. And I've learned that from talking to other massage therapists in your group on how to like, tag a shift on Jane so that it's just for that treatment. So and those are massage therapists that are reaching out to me too. People who have been in practice for a long time, and they're like, wait a minute, I want to keep doing this, but my body is giving out on me. So
Yeah.
kind of cool.
Yeah, it's a real consideration for us because massage is not an easy profession. It's got some flexibility in your hours, depending on, how and where
Yeah.
you especially if you work from home, you've got some flexibility, which is great.
Yeah.
People want deep tissue or
That's
something
right.
similar,
Yeah.
something with some oomph. And to be able to work with a population that actually wants a light touch and that it's appropriate to have a light touch, a total game changer, how your body's able to function. And it can give you longevity in your career. So you're talking about, what's my last 10 years, my next 10 years, maybe I could get 15 or 20,
Yeah.
who knows?
Yeah.
But if you're doing work which is much easier on your body, you're not having the wear and tear, chances of the longevity of your career go way up, like way
Yes.
up. The
Yes.
difference is
Yes.
huge. I mean, I
Yeah.
didn't think I'd make it to 5 years. I thought, at 3, I was like, oh God, I'm going to be out.
Yeah.
And now here I am moving into 15. So it's totally possible. And for you,
Yeah.
you were really questioning, can I do this after your
Yeah.
accident? So that was the challenge that you went through, your physical challenges. Was there any other challenges in starting to pivot your practice, working with oncology patients, learning new skills,
Yeah.
other kind of challenges that you've been able to
Well,
navigate?
I'm not sure how I would label it as a challenge, but I know a big difference is the mindfulness that you've brought into our training. And there's some exercises that you've done with us that just sort of bring you back into the present moment.
Mm.
Um, and that actually is happening throughout all of my practice. So now I'm just like, whoever I'm treating, because I think we can all be guilty if we're just sort of doing the regular shoulder and neck and we start feeling like a robot. And then all of a sudden we find ourselves thinking about a grocery list. And so I'm actually really enjoying, and it's preserving my own headspace is when I can go into a treatment and I'm really, really present in that moment. And that feels so much more aligned and again creates that longevity that's happening. And I think the other part has just been there's a couple things that I've noticed with treating this population is that there to be expected there's a hesitancy, and so really having clear information so that they can connect with you and read about what you're going to offer. But even when you have the information, say on your website or on a brochure, or you've written it on your Jane app that it's a gentle treatment, I'm finding most of the population wants to talk to me ahead of time. So I did add discovery calls to Jane, and I'm finding all of them are happening. I have the option for video or phone, but all of them are happening on the phone. It's rare for it to happen as video. And yeah, they just want to hear my voice. Like they want to hear my voice. They want to hear what it is that I'm doing, what it would look like. They want that reassurance. And you can hear there's like, oh, wow, that would be incredible. Because there's those words of gentle, but there's also that part of it being an appointment that is more than just another medical appointment to them. It's a space for them to be in their body and connect with their body again and hold that space. And often, and I know you've experienced this, it's like my hands can go on their ankles and then they start crying, right? Like, and so because there hasn't been a moment yet for them to just sort of pause and take a breath and be like, oh yeah, I am still here.
Mhm.
Um, and so that's been really beautiful to watch. And in a way, even when I'm doing the intake forms or the assessment, there's a lot more pauses because you have to allow them to feel comfortable to tell their story.
Mm.
Um, and
So
so
you
I
think,
feel like it's made me more of an active listener and all of that part of it as well. Yeah.
yeah, yeah, because that art of listening creates space and allows
Mhm.
someone to share, and maybe they
Mhm.
haven't shared before.
Yeah.
Like you're finding the treatments are metaphorically speaking, touching
Mhm.
in a way that they haven't been touched before. But it's also literal. And
Yeah.
they may
Yeah.
not have had their
Yeah.
breath, their chest worked on before. So it may be
That's right.
new territory for them.
Yeah.
Are you finding that because I kind of find sometimes in the conversation, it's
Mhm.
like metaphorically speaking, they need to get stuff off their chest. They need to
Yeah.
share
Yeah.
their story, what they've
Mhm.
been through,
Yeah,
have someone
exactly.
hear them,
Mhm.
and that in itself
Mhm.
really strong part of the therapeutic process. So
Yeah.
what
Yeah,
would you say about your
exactly.
experience with that?
Yeah, I do find that there's often like other stuff going on in their life that is coinciding with their cancer diagnosis. So there's that part that they need to share. Um, there's also when I've worked with people where there was one woman I worked with where she'd already had surgery and she was having to go back because there were some complications. And then she was going to have surgery on her other breast. And so I worked on that the day I worked on her breast before surgery, and she felt like that really honored that side of her body. So that was kind of cool too, like because people form their own rituals and ceremonies on how and what it is. And she's like, yeah, I want to give that breast some love. And I was like, okay.
Mm,
And so I think that it opens up them talking in a way that maybe they haven't had the opportunity to talk about. And
mhm,
then the next part is that I think when they get the surgery and they often have the follow up with the surgeon, there's a lot that they put onto that appointment and there's a lot that they don't receive, which is unfortunate.
mm,
So they're thinking, I'm going to go and get this follow up and I'm going to have the space to talk and tell about what it is. And then that doesn't happen. And they're often, unfortunately, in some cases, not even looking at the scar afterwards. And so they feel sort of hanging in the dust and they're like, nobody, there's no follow up. And so that's that part that you, I think, really came to making this work is that gap that was happening where
yeah,
you're like, wait a minute, you had the surgery is done. Now what? Go
mhm,
massage? How? Where?
yes,
Like what pressure? When? Like
yes.
that
Why?
confusion.
Why
Why?
are you doing
Yeah.
this thing?
Yeah. Yeah,
Yeah, yeah,
exactly.
yeah, and that's
So,
where we need the bridge is to bridge
yeah.
it over into that community,
Hmm.
into someone's
Yeah.
long-term well-being and
Yeah.
quality of life. Amazing.
Yeah.
Well, in our last couple minutes, I would
Hmm.
if someone was considering the Academy, Mentorship and Training Academy for Breast, Chest, and Oncology Massage, what would you say to them?
I would say that this is such a unique and transformative way of learning and such an opportunity in your career to shift into something that is very heartfelt. But it's even though it's in 6 months, I can already feel its lifetime because I was in the very first cohort and we're still all in touch. And
Yeah.
so we're all still communicating with each other and then supporting other people that are going through the academy as well. So it's great. Like it's like the best staff room ever. Like you're just like, "Oh, I got a question. I'm a bit confused. No problem. I've got this group. I can ask them."
Yeah.
And then the other part is that the academy and I mean taking courses, and I've taken lots of amazing, incredible weekend courses, but this goes beyond in the sense where, when you take a weekend course and you're like, okay, I learned those skills, but I'm not sure how to integrate them into my practice. What am I supposed to do? And then you just hope that you start doing them. This gives you that length of time to look at being like, this is how the skills are implemented. This is the letters that you can create to connect with your community, connect with the surgeons, connect with the other, like the Pride Society, whatever that looks like. So it's really like a step by step. And I think a lot of massage therapists struggle with the business side of things or the promotion side of things. And then that's become a whole part of it. And I can see the benefits that people are getting out of that. And they're so grateful that they've got that to be part of it. So you've really got everything that you need in that moment for this to move forward. Yeah.
I love it. Thank you. I think that will help people confidence that this is a good thing for themselves, for their practice, for their professional development.
Yeah, exactly.
And before we sign off, let's hear about your clinic and what is going on there, because you've got some really good offerings to the world.
Yeah, so we're located in Cumberland in the Comox Valley on the Comox territory. And we have an amazing team of experienced massage therapists. And myself and Jen Ridout have both done the training in the academy. But we've also had meetings together with our team to discuss how we can all work together. We have another massage therapist who has osteo training. We have another massage therapist who has biodynamic fascial integration that she took with Heather Green. And so they're able to really be like, oh, if that's something that you guys are offering, we can refer over to you. But sometimes there's moments, even with our population that we're working with, where we're like, actually, that could be beneficial for you because this person does a lot of visceral work. And then also within our clinic, we have lots of information that's out there. We've also been working with the gender affirming top surgeries and been in communication with a local trainer who works with post-surgical care for top surgery. And we've been in touch with the Pride Society and Foundry. And then in the summer, we do this cool thing. And last year, what we did was we did a fundraiser for the Pride Society, and we did outdoor yoga in the driveway. So I like to think outside of the box. We're always doing cool events to sort of bring people together. And that's kind of the community that we live in anyway. But yeah, it's exciting to have this opportunity to connect with people this way.
Yeah, amazing.
Yeah.
Level. Well, thank you so much, Kirsten, for being here. It's been so wonderful to know your, the results that you've had and hear more about the changes that you've gone through and the wonderful successes that you're getting with your collaborating relationships that you're building with the surgeons and the physios in your area, and really helping, bring awareness and create avenues for people that weren't there.
Yeah, for sure.
Yeah. So that's super exciting. And I really look forward to continuing collaborating with you in the academy.
Me too. I love it.
People, yeah, so useful. They are a game changer for a lot of people.
Great.
Yeah, amazing. Well, thank you, everybody. Thank you for your time. This is Erin at the Mastectomy Guide signing off for now.